Okay, we've been sent another case today. I just want to make some clarifications on uploading cases to me. First and foremost, there's no guarantee that I will look at your case. Life has gotten unbelievably busy, so I'm not promising I'll look at your case. I'm not promising a timeline in which I'll look at your case. And more importantly, I need us to follow some basic principles of the case. I need some instructions on the case, what I'm looking at, what you need me to take a look at, what we need me to evaluate. Simply sending a case with no instructions doesn't really give me an idea of it leaves me to guess, and I don't want to really guess, to be honest with you. So, if you don't mind, I would greatly appreciate it if we gave me some direction here. So it looks like we're evaluating the ability to place an immediate implant in site number 4. Looks like we're going to lose this tooth here, and so let's go ahead and take a peek. Our first question always is digital analog. In evaluating that, we can see here that this person has chosen an analog workflow. Either they chose an analog workflow because they are not a CEREC office, or they don't believe that they can get the CEREC data stitched accurately. My question on this would be that I would certainly make an attempt to get the CEREC data in on this tooth, on this tooth, on this tooth. So I have 3 teeth there that I believe I could get CEREC data on, and this tooth right here looks like it may not be a crown. Again, it might be, I can't tell. So that one's questionable if that's a crown or not. So I would certainly give this a shot to get CEREC data. In this particular case, I would take a full arch. And the reason I would want CEREC data is that it can help me prosthetically plan. And it gives me the ability to mill a guide, and it gives me the ability to have more guide choices. With that being said, obviously an analog guide is certainly a possibility here. And with this scan already taken like so, an analog guide is certainly totally doable. Now, in terms of the quality of the plan, so let's go ahead and take a closer look at that. What I'd like to do is go ahead and outline where I see the bone. So there's the outline of the bone as I see it, roughly. Okay, and now let's go ahead and outline the tooth as I see it. Just like so. So in looking at this, my first thoughts are going to be in terms of what I'm going to see here is, excuse me, it's early in the morning here. What I'm going to say is this is what we're depending on for stability. This area here, that area there, a little bit right here, and hopefully this area right here. The other thing that I'm seeing is we have a significant amount of space here on the buccal, from here to the buccal plate. Very little room here on the lingual plate. Here we can see our guide sleeve is hitting, or appears to hit, our adjacent tooth. We have some space right there. Our occlusal plane is pointing downwards on this. And the other, probably, in my opinion, the bigger concern for me is our screw axis, or our long axis, is coming out the middle of the buccal cusp there. None of which do I like in this particular situation. So for me, my planning in this situation is I see the central groove to be right here. So I would probably go ahead and move the implant like so. And this may make it not feasible to do an immediate placement, and that is unfortunately part of the game sometimes, is that we cannot, in my opinion, just because it's easier to do an immediate and get off-angle implant placement doesn't mean that we should do that. So I'm a big believer in placing implants in a more ideal situation, and then adjusting and then making a determination in whether or not. And I think we can go to a 10 millimeter implant here. Um, if we go like that, okay. So that's me personally. I would be comfortable with that. I would also take a closer look to see. Uh, I'm concerned in this particular case about. Let's go back here. So as we look at it in this slice again, you can see there's quite a bit of space here. We'll probably get some resorption of this. We do look like we have 1.5 mm of space here. So in theory, we could go to about right there. Some will say, hey, we might go into the sinus. That sinus looks pretty clean up here, so I'm not overly worried about that. Depending on your techniques, you could use something like the Versa or the densification burrs. You could do a little bit of a bump right here. You could drill short and allow an active style implant like this to do some of your raising for you there. Here I'm still coming out the incline of the buccal cusp. I'm not a big fan of that here. So, I may cheat a little bit and tilt like that, and that's a little bit more centered coming in through there. And then as we go through it to the 10 millimeter implant, that's fine. And then, my occlusal plane looks better here. And everything looks pretty reasonable here. And then as I go through my 360 check, I start noticing right here that I'm starting to see a significant potential defect right in this area right here. Okay, and I wonder if my buccal plate actually exists in this spot, and what's the likelihood that when I take this tooth out that my buccal plate will remain intact there. These are the things I consider. I take a look at, and then again still have to evaluate. Then is there going to be dehiscence right here where it looks like, for example, right here where it looks like that root maybe coming through the buccal plate right in that area right there. So that's a big question there for me as well. These are some of the questions I would have in this particular case. So I would call this a more difficult immediate placement case. I'm not saying I wouldn't try it or I wouldn't be prepared to do an immediate here. I would definitely be prepared to not do an immediate here and prepare the patient for needing a graft. I would be prepared to have to place a membrane from here over, wrapping it up, and then placing bone, in our case PRF sticky bone. So hopefully this is fine and this helps. But again, please do start providing some directions in the plans as you submit them. Thank you very much.